Men over 50, if you're still doing these 10 things when you masturbate, you could be quietly harming your sensitivity, your erections, and even your confidence. Stick with me for a few minutes, and I'll show you safer, smarter ways that actually protect your sexual health. Welcome back to Healthy After 50_seniors. I'm your urology guide for today. We talk straight, science-based men's health, no shaming, just practical advice. Quick note before we start. This video is educational and does not replace care from your own clinician. If you ever have severe pain, swelling, a popping injury, or an erection lasting more than 4 hours, seek urgent medical attention. All right, let's get into the top 10 masturbation mistakes older men make and how to fix each one. Mistake number 1, using a very tight grip or the exact same technique every single time. As we age, nerves can become a bit less sensitive and skin can get thinner, so over-relying on a death grip or one ultra-specific motion can condition your brain and body to expect only that sensation. The result? Reduced sensitivity, delayed ejaculation, or trouble climaxing with a partner. The fix? Loosen your grip by about 1/3 to 1/2, use more lubrication, and add variety. Change angles, pressure, and rhythm. Try edging, build up, pause, focus on breathing and relaxing your pelvic floor, then resume. If you feel sore or less sensitive, give yourself a day or 2 to recover. Sensitivity often improves when you change the routine. Mistake number 2, bending or twisting a hard erection. This one is serious. Forcefully bending an erect penis can cause a true medical emergency called a penile fracture, basically a tear in the tough outer layer of the erectile tissue. Classic signs are a popping sound, sudden pain, immediate loss of erection, and swelling or bruising. If that ever happens, go to the emergency department right away. Don't wait. The fix: avoid forceful bends during solo or partnered play. If you need to adjust, do it when you're less rigid. And if any injury occurs with rapid swelling or a pop, seek emergency care. Mistake number 3, going dry or using the wrong lube. Friction without lubrication increases micro-tears, irritation, and soreness, especially on older, thinner skin. A quality water-based or silicone-based lube cuts friction and protects the skin. If you use condoms during solo play, remember that oil-based products can weaken latex and cause breakage. Also, skip fragrance soaps or harsh cleansers on the glands. These can trigger inflammation called balanitis. The fix: use a simple, skin-friendly lubricant. Rinse with lukewarm water afterward, and if you're sensitive, patch test new products on a small area of your forearm first. Persistent redness, itching, or swelling? See your clinician. Mistake number 4, forgetting foreskin safety and risking paraphimosis. If you're uncircumcised and you retract your foreskin for play or hygiene, always bring it back to its natural position afterward. Leaving a tight ring of foreskin stuck behind the glands can cut circulation. That's called paraphimosis, and it's an emergency. The fix: retract gently. After you're done, slide the foreskin forward over the glands. If it gets stuck and you can't reduce it, seek urgent care. Mistake number 5, ignoring new curvature, plaques, or painful erections, signs that could suggest Peyronie's disease. Men over 50 are more likely to notice a new bend, a firm plaque under the skin, shortening, or pain during erections. Early evaluation matters because there are more options before things progress. The fix: if you notice new curvature, pain, or a palpable plaque, book an appointment with a urologist. Don't try to push through pain or force straightening. That can worsen injury. Mistake number 6, treating erection changes like a purely mechanical issue and skipping a heart check. Erectile function is closely tied to blood vessel health, and erection changes can be an early warning sign of cardiovascular disease. If your erections have weakened over months, use that as a prompt to get your blood pressure, blood sugar, and cholesterol checked, and to talk with your clinician about your overall risk. The fix: improve the fundamentals, regular aerobic activity, weight management, blood pressure, and glucose control, enough sleep, and not smoking. What's good for the heart is often good for erections. Quick favor while we're here: if you find this Straight Talk men's health content helpful, please subscribe to Healthy After 50_seniors and tap the bell. Your support helps us keep making evidence-based videos for men 50 and older. Thank you. Mistake number 7. Overusing numbing sprays or creams to control ejaculation. While topical anesthetics can help some men with premature ejaculation, overuse can reduce pleasure, worsen numbness, and even transfer to a partner, which isn't ideal. They're tools, not cures, and they work best with clinician guidance and proper technique. The fix: consider behavioral methods first: start-stop, squeeze techniques, mindful breathing, and pelvic floor training. If you do use a topical, follow directions carefully and talk with a clinician if you need ongoing help. Mistake number 8. Leaving constriction rings on too long or misusing vacuum pumps. Vacuum erection devices and tension rings can be safe and effective, but a ring should not stay on for more than about 30 minutes. Longer than that increases risk of pain, bruising, or tissue injury. The fix: learn the quick release. Set a timer and avoid rings altogether if you're on blood thinners or have a bleeding disorder unless your clinician says it's safe. With pumps, keep the pressure moderate and follow the instructions. More pressure is not better. Mistake number 9. Believing myths that masturbation causes prostate cancer, erectile dysfunction, or infertility. The evidence does not support these fears. What matters more is comfort, skin health, and overall cardiovascular wellness. Frequent ejaculation in itself is not harmful for most men, and for many, regular sexual activity supports mood, sleep, and pelvic floor function. The fix: let go of the myths and focus on safe technique, lubrication, and healthy lifestyle habits. Mistake number 10. Ignoring pelvic floor training and whole body habits. The pelvic floor muscles help with rigidity and control. Training them, often called Kegels for men, can support erectile function and ejaculation control, and it may help urinary symptoms as well. The fix: practice correct contractions. Imagine stopping urine flow or preventing passing gas. Gently squeeze and lift. Hold 3 to 5 seconds, then fully relax for 3 to 5 seconds. Aim for 10 reps, 3 sets a day. Combine that with brisk walking or cycling most days of the week. Resistance training 2 to 3 times weekly, good sleep, stress management, and limiting alcohol. These fundamentals are powerful for sexual health at any age. Bonus tip: pay attention if ejaculation becomes painful. Some men experience pain with or after ejaculation due to chronic prostatitis or chronic pelvic pain syndrome. For some, ejaculation can flare symptoms. For others, it helps. If you notice ongoing pain, especially with urinary frequency, urgency, or burning, get evaluated. There are treatments and self-care strategies, but you need a proper assessment. Let's quickly recap your action plan. 1. Ease the grip and add variety. If you're sore, give yourself recovery time. 2. Never forcefully bend a hard erection. If you hear a pop with sudden swelling, that's an emergency. 3. Use appropriate lube and skip harsh soaps. Protect older skin. 4. If you're uncircumcised, always return the foreskin to its natural position to avoid paraphimosis. 5. New curvature, plaques, or painful erections deserve a urology visit. Early is better. 6. Treat erection changes as a check engine light for heart health and get your numbers checked. 7. Be cautious with numbing sprays. Use them correctly and consider behavioral training and pelvic floor work. 8. Don't keep a tension ring on for more than about 30 minutes. Use pumps carefully. 9. Drop the myths, focus on safety, comfort, and overall wellness. 10. Train your pelvic floor and take care of your whole body. Movement, sleep, nutrition, and stress control all matter. Before we wrap, a final word on safety. If you ever notice severe pain, rapid swelling, a popping injury, fever, discharge, or sores that don't heal, contact your clinician. If an erection lasts more than 4 hours, go to the emergency department. This is your health. Take it seriously. If today's video helped, please subscribe to Healthy After 50_seniors and share this with a friend who wants clear, evidence-based men's health guidance. I'm proud of you for investing in your sexual health smart, safe, and shame-free. I'm your urology guide, and I'll see you in the next video. Disclaimer to speak at the end. This video is for general education only and isn't a substitute for medical advice, diagnosis, or treatment. Talk to your own clinician about your specific needs. If you think you may have a medical emergency, call your local emergency number immediately.